Immunosuppressants. These are drugs used to suppress the immune response and administration. They are commonly used in transplants because in order for the body to accept or to adjust for receiving a transplanted organ, immunosuppressants lower the body's ability to reject it. They are also used for the treatment of autoimmune diseases. So these are the types of immunosuppressants and their clinical uses. First is glucocorticoids. They're the most commonly used immunosuppressive agents used for the treatment of inflammation and immune-mediated skin disorders. Glucocorticoids interrupt inflammation by suppressing the proteins and production or actions of inflammation-associated molecules that promote inflammation. Second is cyclophosphamide. They are used in combination with glucocorticoids for severe cases of autoimmune diseases such as systemic lupus erythematosus. It is a type of lupus that causes widespread inflammation and tissue damage. Cyclophosphamide interferes with the growth of cancer cells. Third is a chlorambucil. It is administered alternately with glucocorticoids. It is mainly used to treat chronic lymphocytic leukemia, a cancer of white blood cells. Chlorambucil interferes with the DNA replication and damages the DNA in a cell and induces cellular apoptosis. Next is azathioprine. It is most commonly used for pemphigus, which is a rare group of autoimmune diseases which causes blisters in the skin and mucous membranes. Azathioprine inhibits purine synthesis, which is important in producing DNA and RNA. With azathioprine, less DNA and RNA are produced for synthesis of white blood cells. So with less white blood cells, there is a lower level of immunity or immunosuppression. Next is cyclosporine. It is used in various diseases but is nephrotoxic, hepatotoxic, and toxic to digestive tract. It is not good when there is high production in T lymphocytes, a type of white blood cell, because it means that an organism may have cancer like lymphocytic leukemia. So with cyclosporine, it prevents lymphocytes from proliferating. It inhibits interleukin-2, which regulates the activities of white blood cells. Lastly, the dapsone, which has immunostimulating effect in lower concentration, but an immunosuppressive in higher concentration. It is used for canine pemphigus, a type of autoimmune disease that causes blisters in the skin and mucous membranes, and also for lupus erythematosus that causes widespread inflammation. And dapsone allows for decrease in the dose of glucocorticoids. That is why it is also called as a glucocorticoid sparing agent.